As spring approaches, everybody starts to move outside and starts to beginning their walking programs or running programs, jogging, etc. What they should actually start to do is slowly progress into these types of activities. Before they even start to venture out in the spring, they should actually do a checkup of their footwear, because the footwear is the main interface between you and your environment. So it'll allow you to manage uneven surfaces, and it'll actually allow you to reduce the amount of impact shock, so the shock that travels through your body every time you hit the ground. My suggestion would be, if you want to start a program, rather than going for a jog for 5 kilometers, I would walk for 2 kilometers, jog for 1 kilometer in the middle, and then warm down with a 2-kilometer walk. And then gradually, over a 2 or 3 week period, move that up to that 5-kilometer jog, so that you get that reaccommodation to the stresses that can be experienced during those activities. For walking and jogging, you want to have something that allows for cushioning, so cushioning of the impact, so especially for jogging, less so for the walking, but you do need a small amount of what's called midsole material, which is a cushioning material, and it prevents the transmission of shock. So you should look for something, footwear that has somewhat a higher heel level of midsole material, so maybe about 1 inch at the most. Half an inch would be preferable, and then as it tails off into the forefoot, because as the front of the foot, because you're using that to push off, and if you have a cushiony forefoot or front of the shoe, then you're not able to push off as quickly, and you're not able to move as fast. So that's the best. The second kind of aspect is the motion control. So if you are a pronator or have a flat foot, you want some arch support. And you can also look at the back of the heel, which is called the heel counter. And there are motion control characteristics of footwear that actually help you when you're a pronator or you have a functional flat foot. The motion control is important because the pronation of the foot can actually transfer into internal tibial rotation, or rotation of the lower leg. And that rotation of the lower leg can actually put stress on the ligaments of the knee and of the hip. And so you can experience shin splints, chondromalacia, a whole bunch of different disorders or pains that are experienced within the lower leg. So it's very important to control the motion, because we are experiencing 3 to 5 times body weight every time we hit the ground while we run. And so this impact loading is actually doing this damage. It's actually transferring shock through every joint in the lower extremity. So it'll transfer the shock through the ankle joint, the hip joint, and the knee joint especially. And this is where the ligaments are being stressed.